May 13, 2026, the FDA approved a new all-oral treatment option for older adults with newly diagnosed acute myeloid leukemia who are unable to tolerate intensive chemotherapy, a combination of Inqovi and Venetoclax. At first glance, this may look like another incremental leukemia approval, but beneath the surface is something more interesting, an attempt to reprogram how cancer cells remember who they are. Acute myeloid leukemia is not simply uncontrolled growth. In many cases, leukemia cells become trapped in an immature state, unable to differentiate, resistant to death, and protected by altered epigenetic programming. Part of that programming involves DNA methylation. Throughout the genome, cells place tiny methyl tags onto DNA, chemical markers that act like silencing instructions, telling certain genes to stay quiet. In cancer, these silencing mechanisms can become distorted, shutting down genes involved in differentiation, apoptosis, and tumor suppression. Enter decitabine. Decitabine resembles one of DNA's normal building blocks. As leukemia cells rapidly divide and copy their genome, they unknowingly incorporate this imposter into newly synthesized DNA. Then something unusual happens. Enzymes called DNA methyltransferases, the machinery responsible for maintaining methylation patterns, attempt to bind and modify the altered DNA. Instead, they become trapped, disabled, removed from circulation. With each new cycle of replication, methylation marks begin to fade. Genes that were once silenced may gradually reawaken. Programs for maturation may return. The leukemia cell may begin losing the identity that allowed it to persist. But changing identity alone is often not enough. Many AML cells survive by overexpressing BCL2, a protein that functions like a molecular bodyguard, preventing damaged cells from activating apoptosis. That is where Venetoclax enters. Venetoclax blocks BCL2, lowering the threshold for programmed cell death. One therapy loosens epigenetic restraints, the other removes survival protection. Together, the strategy is not merely to poison leukemia cells, but to make them vulnerable again. In the pivotal study supporting approval, approximately 42% of treated patients achieved complete remission, with responses often occurring within 2 months. For older adults with AML, where treatment intensity has historically been limited by frailty and comorbidity, this approval represents another step toward precision approaches that alter cellular behavior rather than relying solely on cytotoxic destruction, because sometimes the most effective way to fight cancer is not only to kill the cell, but to change the instructions it has been following all along.